Just trying to. Good morning,
Yeah.
everyone. Welcome. It's 6 a.m. on the 19th of March. I have a friend whose birthday is today. Happy birthday, Carlos. Uh, please let us know where you're watching from. And we're going to be talking to Dr. Driscoll in a second. Just I remind you there that you can put the questions in the chat and we'll try to get to them as soon as possible. Good morning, Ali. How you doing? Do you have any?
I just want to remind everybody that we have some lovely health coaches that are here ready to serve you and help you out. So I'm going to put that link in the chat, and anyone is welcome to sign up for an intro call with one of our coaches. Anywhere on the planet, no matter where you are, you can sign up for an intro call. It's not limited to the United States. There you go.
How about if they're elsewhere outside the planet?
If cell service works, totally cool.
Okay.
That's great.
And our next 4 events are April 6th, the cholesterol code film screening. We're going to do that in St. Petersburg with Dr. Vadia, Dr. Boss, Susie Boshoff, Dr. Kiltz, and I will be there. Also, April 11th in Long Island and April 12th in Queens. Please go to kiltzmeetup.com and you can find all the details there. And again, we're going to be trying to do the cholesterol code film screening in Orlando, April 22nd. All the information is in kiltzmeetup.com. And if you're not a member of the Kiltz Tribe, please sign up. How much is it to sign up for the Kiltz Tribe?
It's free. You have to sacrifice your email address.
All right. So, good morning, Dr. Diana.
Good morning, Dr.
How are you doing today? Where are you coming from?
Okay. I was telling Ali, I'm in Italy today.
Oh,
so,
okay.
So
what time is it?
It's a very comfortable 11 o'clock in the morning. How about you?
It's 6 a.m. in Florida for me. I'm
sorry.
In Central Florida.
I'm good over here, yeah.
So why don't you go ahead and introduce yourself, tell us what you do, and let's talk about stuff.
That sounds great. Sounds great. I'd love to do that. Like you said, I'm Dr. Diana Driscoll. I am an optometrist by training, although I haven't done routine optometry in a long, long time. Instead, I deal exclusively with the autonomic nervous system. And it started out with investigating POTS, postural orthostatic tachycardia syndrome, which you may have heard. Some people have come across this, that it's not uncommon in post-COVID. We were ready for that. We've had POTS care now open over 10 years, but we look for the underlying causes of this autonomic nervous system failure. What else is happening, and restore health, get rid of that. So out of that came a research company. I've got 5 patents to date, and then a supplement company based on some of these patents. So once we conquered POTS, I took a step back and said, what have we learned about this nervous system that could help the more general population? Could we be healthier, stronger, live longer, have better quality life, et cetera, as we age, if we actually paid attention to this? We don't have to have POTS. We don't have to be critically ill to have some of the effects on the autonomic nervous system. And I think we need to recognize those and help with them. Yeah. And you guys talking about like the keto diet, the carnivore diet, it was very near and dear to our hearts, because one of a few universal commonalities among patients with autonomic problems is we're devastatingly ill with sugar, any sort of increase in glucose. So it made us look into what are the causes of that, what can we do to control that, et cetera. So I thought our talks could probably dovetail fairly well.
Yeah.
That was a long-winded answer, Dr. Nelson. I'm sorry, but it was a long journey.
That's very
Yeah.
good. Thank you for being here. At least it's not that early in the morning for you, and that's good. Uh,
Yeah.
and you mentioned Amy, or Alia mentioned Amy?
Amy mentioned Amy.
Oh,
Amy's
okay.
here watching. Hi, Amy. Good morning.
Go ahead and let's read her question. Please put your questions in the chat for Dr. Driscoll.
Amy asked, Dr. Diana, I've been doing carnivore for 2 years now. My POTS is so much better. I'm far less dehydrated on carnivore. I've lost a bunch of weight and had a PFO and ASD plus more fixed. I don't know what PFO or a.
Yeah, it's
patent foramen ovale.
Mm-hmm. Yes.
Colloquially, a hole in the heart.
Oh, okay. Okay, got it.
Yes. And stop me if I talk too much.
No, go ahead, please.
It's your
Kind of a
hour.
long explanation. But Amy, one, it's great to see you here. Yeah, we do. We go way back, which is just awesome. I initially got on YouTube, gosh, what was it, 20 years ago? I was a patient. I had POTS. I was disabled by POTS. My kids ended up sick. My son was disabled by POTS. He missed 3 years of school, developed severe osteoporosis. He broke his arm just throwing a ball, putting on his coat. We were extraordinarily ill. We were in clinical trials at Mayo Clinic for 3 years, and their conclusion was, we have no idea what's happening. We think maybe you're normal, but you're just more aware of your own body. So that started a journey of, okay, we are on our own. We have to figure this out. What we're looking at with POTS, and we're stepping away completely with the traditional approach of POTS. That is useless. They tend to approach it like it's a mild case of dehydration. And I don't know, Dr. Nelson, if you know, but a POTS patient, when they stand up, their heart starts to race. And it's one objective marker that we have for this autonomic nervous system problem. But that's not what makes them feel so sick. We can handle a fast heart rate. You know, you go work out and your heart rate goes fast. It's what's causing that makes us feel so sick. But in patients with POTS, they are invariably dealing with some sort of chronic inflammatory condition that's affecting the cardiovascular system. So cardio in that the heart rate increases, vascular in that the inner lining, the endothelium, if you will, of the blood vessels becomes damaged, it becomes a little more sticky, a little more prone to clotting. And we don't circulate blood as well. Veins tend to dilate. Patients stand up and the blood pools. And then their heart rate increases also because of the pooling. Something is causing the heart and the cardiovascular system to react to that. And one thing that can worsen cardiovascular inflammation is adipose tissue, or if we gain weight. So the inflammatory cytokines kicked out just by bodily fat can worsen that. And I think, Amy, what you're experiencing is likely the weight loss lowering some of the inflammatory components, which is really great, right? In the probably 90% of the patients we see at POTS care, they have kind of an opposite problem. They end up basically malnourished, have malabsorption syndrome. We see a lot of very low weight patients. We had one, probably the worst. She said she was 80 pounds. And then when she got online for us to help her, I could see there was no way she weighed 80 pounds. She ended up doing great, you know, but we face, or oftentimes face, just the opposite problem. But Amy, that's probably why it's helping you. And I'd love to see you get to a normal weight where it's really healthy for you, and then control it so that that'll help keep some of your inflammation down. Yeah.
Can you have
Mhm.
POTS sort of okay, I'm trying to ask this the right way. A temporary thing, not a genetic predisposition, not a chronic problem, but uh, one of the things, and this is me,
Yeah.
when I ended up losing 120 pounds, and you can see
Wow.
here before and after,
Hmm.
and came off two very powerful blood pressure medications that I had been taking for a while. I don't
Hmm.
take medicine now. My blood pressure is normal, and I don't have the symptoms anymore. But probably for a year after doing that, I ended up, every time I stand up, I would get tachycardic, and it would take
Yeah.
some time to adapt. Uh, I did pass out once, but
Mm.
that was my blood pressure. That was the last day I took my blood pressure medication because I was
Yes.
tapering off for 7 or 8 months.
Yes.
But I did have symptoms of POTS
Yes.
for a while after my body was adapting to that change.
Yes. And that's likely very similar to what we can see in temporary changes, say post birth, childbirth, where in pregnancy we have a lot of blood volume, we have a lot of volume, and then we lose it upon birth, and we tend to develop symptoms like that.
Yeah.
Yeah. So there's, and each patient does have to be picked apart. There's orthostatic intolerance, there's POTS, true POTS, there's orthostatic hypotension. It does need to be picked apart, but the patients we see at POTS care are not a transient, something
Yeah.
caused this
It's
thing.
usually a chronic thing.
It's
What's
also
the,
more than just that.
yeah.
That's just one sign, but they are sick from head to toe. There is no system of the body that goes unaffected. It isn't just, the fast heart rate or feeling dizzy. And that's one of the misunderstandings with it. It sounds like just from the name, it's a heart problem. No, it's an inflammatory problem, and patients do not get better. They tend to get worse.
And
Yeah.
it's affecting the autonomic system.
Yes.
What's the connection there with people who may have histamine intolerance, MCAS, or
Mhm.
EDS? What's the connection?
Yes. I don't know if you've,
Because seems to be concomitantly present very often with those things, right?
when I was diagnosed, again, it was like 20 years ago. Um, I was also diagnosed with EDS, and you're talking about Ehlers-Danlos syndrome or joint hypermobility syndrome. I checked my kids, and they were also flexible. We didn't know that prior. And I remember the doctors saying, "Oh, well, you have POTS because you have a gradual laxity of your blood vessels over time, allowing the blood to pool." And I said, "I understand how that sounds right to you." But my illness was dramatic and almost overnight. I got a virus when I was overseas, and 2 weeks later, POTS symptoms occurred, and it wasn't mild. I couldn't push through. I couldn't see my last two patients that day. Every system of the body was affected. I ended up bedridden. And then my son was 8 years old. He got a series of 3 viruses, just regular viruses. All of his friends recovered, and each one knocked him down further until he was also bedridden and disabled. And then the research I did into connective tissue, because they were saying EDS or joint hypermobility is a genetic disorder of collagen. And collagen helps hold our tendons and ligaments together, and it makes up the blood vessels. So I looked into what type of a genetic issue could cause problems with the collagen of blood vessels, as they were saying, it was allowing them to dilate or stretch out, if you will. And those genes, we could already test for those, Marfan syndrome, Lloyd-Dietz syndrome, vascular EDS. We did not have those. If we did not have those, the collagen in the blood vessels should not even be affected. So I felt like at that point, they just weren't thinking things through. Okay. So we had to step back, take away those labels. Unless they could prove the genetics of EDS, we're going to ignore that. Okay. Instead, look at, could an inflammatory problem, perhaps genetically based, where we can't regulate certain forms of inflammation, allow certain triggers like a virus or COVID or whatever to cause this inflammation to run away, do damage, and then other dominoes start to fall. And some of the chemicals that are released in these inflammatory conditions do affect the cardiovascular system and more. One chemical you mentioned is histamine. And one reason in POTS that's really significant is because it's just brutal on the blood vessels. You know, it causes vasodilation. It contributes to the endothelial damage. There are receptors on the heart for histamine that increase tachycardia. And we like to block that, but it isn't a histamine problem. And in the majority of patients, it's not a mast cell activation problem either. I think these labels get thrown around way too easily. But in our patients who display like mast cell activation, as they're flushing, they're getting sensitive, tachycardic, etc., we want to check tryptase. And if tryptase is normal, it's not mast cell activation. Our true mast cell activation patients always, no exception, they always have high tryptase. And then we look at, okay, if the mast cells are activated, that's still not your underlying problem. What is activating them? And why is the body not controlling that like somebody else, right? So it's an unfortunate position, more than unfortunate, for patients to be in, dealing with all this, and basically their doctors are scrambling. They can't quite put it all together. It was a very frustrating journey for me and my family, certainly. Yeah.
All right. We have other questions, Alia. Let's.
Yeah, we do. Of course, I have a question, but let's get these other questions first.
Okay.
Are there actual racer eggs? Are there effective methods to prevent? I'm guessing POTS.
Well, because patients can develop POTS from many different avenues, right? So, and it isn't a heart problem. It's not like you can address the heart. When I got sick, my eating was excellent. It basically was like a hobby. Nutrition was a hobby. I was in great shape. My weight was perfect. I exercised. I taught exercise. It wasn't like, and initially the doctor said, well, you need to eat good and exercise. And I remember thinking, okay, I already do that. That wasn't enough to keep me from getting sick. So what ultimately our goal is at Genetic Disease Investigators is to figure out all the genes that would regulate the type of inflammation that controls this cardiovascular response. And if a patient falls into that where they, through no fault of their own, can't regulate that inflammation that gets kicked off, if we know they're prone to it and they are exposed to some sort of potential trigger like COVID or what have you, then we can jump on it right away and they don't have to get sick, right? And to me, that seems a good goal. We could also label the patient based on the objectivity of the genetic challenge. So that's one of our goals, is to get that out there. So I don't think it's so much just everybody needs to be able to prevent POTS. I think most people aren't genetically set up to develop that inflammatory response, right? They don't have to worry about it. But if we are predisposed, and sometimes you have a clue just by talking to the family, they'll say, oh, Aunt Sally dealt with something. She never was quite right. Or my kids seem to be fussy eaters, or, you just some clues that things are happening here that no one is fully understanding. Yeah, then those we would like to identify as quickly as possible, like at birth. How
Oh,
great would that be?
that would be great.
Yes.
Someone asked about mast cell activation. You just talked
Mhm.
about that. Afshan just asked about that. Anyone else, please put any questions into the chat. I guess I'll take it a second. So my brother has EDS.
Oh,
I'm
sorry.
very flexible myself, and I have lipedema. And I'm curious if
Yeah.
you run into patients that those two things connect,
Yes, we
and
always
what you
look
do with
at
that.
that. Please let me, and anyone who listens, if they want a copy of the Driscoll theory, again, it's a book I put out 15 years ago, tying all this together with EDS. And there's a whole chapter in there, Ala, of where did we go wrong with EDS? This is a very personal thing to me. I don't think we should even be using that label unless we can point to the genetics. I remember the doctor saying, "Oh, you have EDS." I said, "Oh, really? What are the genes responsible for that?" They said, "Oh, we don't know that." And I said, "Okay, if you don't know that, how do you know it's a genetic disorder of collagen or connective tissue?" I said, "Well, you're flexible, you're showing stretchy skin or whatever." So, okay, how do we know it isn't a genetic problem with regulating inflammation? Because inflammation can weaken connective tissue. We see that all the time.
Yeah.
And I said, or what if some patients have both, a weakened connective tissue and a genetic tendency to get inflammation that further weakens it? And they're going to have a kind of a double whammy. The treatable aspect of that is the inflammatory aspect. And I was met with just these blank stares. I think that's really unfortunate. So again, getting back to the genetics of that, I wouldn't accept a label unless you are shown the genetics of it and there's nothing you can do. There is no treatable aspect to this, right? You just have to live with it. Oh, I just wasn't going to do that.
Yeah.
So absolutely that is tied in. We are in the dark ages, I think, with a lot of chronic inflammatory conditions. We remain in the dark ages in connective tissue disorders, which is very unfortunate. But no, Ala, I'm hypermobile, I'm stretchy, I don't see EDS, right? But I don't have POTS, I'm not sick, nor do my kids get sick. And we don't plan to be sick. But we know what set us up for this, and we can take very good care of it so that we're not sick. Okay.
There you go. This is
Yeah.
from the real Dr. Nelson. What is the specific role of blood sugar spikes in triggering POTS symptoms, even in healthy individuals?
Yes, no, I love this question. I do. Of course, I'm an eye doctor by trade, and we look inside the eyes, which is the only place in the body you can look directly at blood vessels, right? You don't have to look through tissue or whatever. And one of the first studies we did with POTS, we had no answers at all. And so I brought in 35 patients with POTS and 35 aged matched normals and just looked in their eyes, right? I didn't know what I was looking for, but I thought if I find anything, I have to guess who's a patient and who's not. I'll give it a whirl. I was able to identify patients almost 90% of the time just by looking at the back of their eye. As a trained optometrist, though, nothing I saw was something we learned in school that, oh, this is alarming. One thing I saw was mild vascular fibrosis or scarring at the veins. And when I finally put that together, and you can tell because veins inside the eye are very smooth, the caliber is very smooth, but in patients, oftentimes it was more lumpy, if you will. It wasn't quite as smooth. And I'd see that and go, okay, not to the point of aneurysms here, but what is happening? And then went into what inflammatory chemicals could be causing this fibrosis or scarring or damage to the endothelium. We know, and all doctors know, diabetes really is a disorder affecting the vasculature. And the reason is the increase in blood sugar activates some of the inflammatory cytokines that damage the vascular endothelium and can cause weakness and small vessel disease, etc. We see a ton of small vessel disease at POTS care. So patients who are dealing with inflammatory POTS are dealing with vascular inflammation, endothelial damage. They have a spike in blood sugar. Both the blood sugar itself and the insulin can trigger problems that worsen that vascular inflammation. And they get tachycardic, the blood vessels leak, the veins dilate, blood pools, the sympathetic nervous system is activated, and they feel terrible, pretty much universally. So we always suggest trying to maintain as stable blood sugar as possible to prevent that damage. Yeah.
How does diet recommendations in your patients, in people dealing with pot work? What do you normally would recommend to those patients?
There is no cookie cutter diet. I will say that. But we can look at the commonalities and guide, right? Like one of the commonalities is that sugar, I don't know that there's an exception to this, causes problems pretty much immediately, right? But the patients have a vast array of different inflammatory conditions. There's a page on potscare.com called Inflammatory POTS, where I listed many inflammatory conditions that can drive this. It might be, worth if someone's trying to figure out what kind of inflammation they're dealing with, what have they ruled out or not ruled out. So some inflammatory conditions are going to be more sensitive to certain foods than others. And I will say that as the patients get sicker, because they generally will, they get more inflamed, they get much more sensitive. I know I got to the point I was down to literally, Dr. Nelson, 2 foods, and I could barely tolerate that. I was down to rice and green beans, and I would still flush, get tachycardia sometimes. The idea is to identify and address and calm the inflammation, then our ability to tolerate certain foods improves. But sugar and highly processed foods will usually activate generalized inflammation and worsen patients, almost always. Yeah. And then, as you probably know, I'm sure you know, blood sugar spikes are much more dangerous even than having slightly high blood sugar stably is actually less dangerous than having it low with it periodically spiking. That's one of the worst things that can happen. So yeah, we do tend to see, we do have to pay attention to diet. We ask the patients for the first few months of treatment to see how their heart rate does after they eat a certain food. And it's very sensitive in a POTS patient. If they eat a food that's causing the inflammation to react, their heart rate goes up. So if the heart rate goes up more than 8 to 10 beats or so, set that food aside, continue to work through recovery, and try it again another time, right? Yeah. But also, like I said, about 90% of the patients we see are underweight, malnourished, leaning toward low electrolytes, dehydration, because the blood vessels are leaking. The gut ends up doing terribly because the inflammation actually interferes with the vagus nerve, the parasympathetic nervous system. The gallbladder doesn't work right. The stomach acid doesn't work right. Pancreas doesn't work right. Their bowel movements are abnormal, and they end up with rather dramatic dysbiosis, the imbalance of good and bad bacteria, and then that worsens the colon inflammation. We do need to normalize that first to give them a chance.
So most of the listeners that we have right now who's are live, watching live, are either carnivore or are following a very low carbohydrate diet, and
Mhm.
heavy meat or carnivore curious
Yes.
people. And
Carnivore. Yes, that's a good.
yeah,
That's great.
uh, and many have discovered by a process of elimination, they end up having basically a high fat carnivore diet because it seems to be it's probably the best elimination diet if you know anything about Michaela Peterson, for example, and seems to lower inflammation in many people. So
Yes.
the next two questions that I have here
Mhm.
are, I'm setting up the background of people watching. Jennifer
Yes.
Edwards is asking, do you think a high fat carnivore diet helps with these issues?
Yes. Excellent. Um, there's, of course, pros and cons to both. And know that POTS patients are special. We just are, extraordinarily sensitive. And like I mentioned, underweight, they struggle with dysbiosis. So where a carnivore diet can be so great, and I think Amy's noticing that, is the blood sugar regulation, right? Weight loss, tremendous. One commonality we see among patients is a tendency to develop high intracranial pressure, increased fluid pressure in the head. There's medication for that. It's an inflammatory reaction, okay? But we want to be able to, if the patient is overweight, bring the weight down. That's part of the problem. Blood sugar spiking, damaging the vascular endothelium, contributes to the high intracranial pressure. The medication for that, though, Diamox, encourages acidosis. So we have to be very careful with like a ketogenic diet that the acidosis doesn't get worse. For carnivore, it's more the GI. Are we getting proper bowel movements? Do we have enough fiber in the diet to keep all that normalized? Because the dysbiosis can end up being a real problem in some patients. We have gastroparesis, for example. We can restore the vagus nerve. That's where some of those patents came from. But with the carnivore diet, I really like it for blood sugar regulation, and certainly if you need weight loss. Yeah.
You mentioned a website. I was looking through when you mentioned the book. I found
Yes.
this is your website, drdianadriscoll.com.
Yes.
And the Driscoll Theory is the book.
Yeah.
Uh, is it on Amazon for people?
No,
No.
it's
Okay.
yes. So
And
it
what
okay.
what where would be the best place to find it? Here?
I think potscare.com is probably the best place.
Okay.
Yeah.
And so here,
That's
potscare.com.
yes.
All right.
Mhm.
Uh, so the next question I have,
Mhm.
also related to diet.
Mhm.
You want to read that, Alia?
Sure.
Please.
Sorry, my electricity went out. So I'm
That's
back.
okay.
I have EDS, rheumatoid arthritis, and fibromyalgia. March 31st will be 365 days of strict beef, butter, salt, water, and black coffee. Recently, I've been having a flare somewhat. Ups. A flare up. Okay, what more can I do to help collagen?
Oh gosh, this is so much to unpack here, right? It's interesting. Amanda, she has EDS. Again, we look at, okay, is this an inflammatory genetic tendency, right? We understand you're hypermobile, stretchy, so am I, but some of this could be treated. The RA, rheumatoid arthritis, I'm going to assume they did a real diagnosis on that. I have seen doctors say, well, you're presenting like rheumatoid arthritis, the blood work is negative, but it must be. And that was wrong. So do make sure your diagnosis of RA is concrete. Fibromyalgia, I'm so sorry. It's kind of like the chronic fatigue syndrome, even POTS to some degree it's slightly more objective, but this is where doctors like to put patients who have pain that they haven't been able to help. And I will tell you, the mainstream medicine doesn't look at fibromyalgia like it's real. They tend to see it as more psychiatric, anxious female, hypochondriac. We don't get the validation for that we should get. I know when I went through this as a patient, ended up with just paralyzing pain. And I was in the hospital and the doctor said, well, I'm just going to put you down as a chronic pain patient. I said, oh, no, you're not. I know what you think of those people. I said, and this is inflammatory pain. I can feel it. I said, it's like you're trying to give me a pain pill while my hand is over a flame, a candle flame. Instead, first, remove my hand from that flame and we have a fighting chance. And they did an MRI of the tissue and it lit up with the inflammation. The radiologist could see that. I wonder how many fibromyalgia patients are inflammatory patients, and we try to deal with this pain. Whereas if we could stop the destruction of tissue, we could actually recover. So the strict beef, butter, salt water, and black coffee, I don't know if that means that's all you had.
That's
Surely
all.
not.
That's carnivore.
That's all they're eating,
Very
yes.
carnivore.
Okay, that's all they ate. We want to make sure you're getting the micronutrients you need, certainly. But one thing that happens in our inflammatory patients is there's also oxidation. And the oxidation continues to get us damaged. The inflammation worsens from it. It increases anxiety type symptoms, almost an OCD, attention to detail, but it continues the damage. Controlling the oxidation is important, and there's certain foods that will help do that. There's a supplement I created called NAC Max that is designed for that oxidation, and that would probably help. But if I assume you don't have POTS, I would suggest something to you. With an RA diagnosis or even a suspicion of that, when we were first figuring out that a lot of inflammatory conditions kick out excess histamine. These inflammatory cells of all types burst, these chemicals are released, but histamine is very damaging. We want to block it. We had RA patients online, we would talk about it, say it was the first time in their life that they were pain-free just by blocking the effects of histamine. So we used H1 and H2 blockers, something like Zyrtec and Pepcid AC. With RA and certainly with EDS and fibromyalgia, I would absolutely block histamine. Yeah. And then you want to be careful with your weight because you can get too low, right? In some cases, and then that's a form of stress on the body, and stress activates the sympathetic nervous system when we get out of whack. But whenever I hear I'm having flares, a flare is a word that we use for an inflammatory state, right? Inflammation flares. Genetic disorders don't flare. Inflammation flares.
We have another guest here,
Oh, he's sitting in the
Dr. Kiltz.
That's excellent. Hi, Dr. Kiltz. You're in your private.
It's a little loud here, and I'm just, I could listen. That's the best I could do, probably.
That's excellent. It's nice to meet you. Hopefully, you're not flying the plane.
Not this time.
Oh, good. Okay. Excellent. Excellent.
Oh my God.
So you spoke about the vagus nerve, and what is the vagus nerve gut feedback loop, and how does it meat-based nutrition support it?
Yes. This is a fascinating cycle that no one had picked this apart before. where certain elements of inflammation and the meat-based diet, or even keto to some degree, can control some forms of inflammation, right? Which is awesome. But if inflammation is running away and it does damage, it blocks vagus nerve function. What I was able to look at was, is this a vagus nerve problem or is this a bigger problem? Meaning the chemical that the vagus nerve uses, acetylcholine, if it is not getting released in other places that it's used, like the brain for short-term cognition or short-term memory and cognition, tear production, pupil size, then it's a bigger problem than a vagus nerve problem. And that's indeed what it turned out to be. But when inflammation interferes with the release of that neurotransmitter, our ability to digest food goes down. And very importantly, the vagus nerve is the anti-inflammatory nerve of the body. So here you have inflammation interfering with the nerve that helps us control inflammation. So as an inflammatory patient, I will tell you, when that happened, that cycle of inflammation just immediately, I was going down the drain and I couldn't break that cycle. So what became obvious to me, that part of this at least, was the vagus nerve. Again, it was bigger than the vagus nerve, right? But I got to the point where the gastroparesis was so bad, I could not have a bowel movement. Nothing was working. The valve between the large and small intestine was slammed shut. The nephrologist confirmed that with imaging. And I sat in bed and I thought, okay, I'm on my own. I've been everywhere, emergency room, surgeons, whatever. No one can figure this out. Can we use the neurology to stimulate that nerve? And I remembered in optometry school learning these neurotransmitters. And I thought, okay, this is a parasympathetic nerve, but the vagus nerve is special. And I remember thinking the nerve goes down into the chest, into the abdomen. There's a gap or synapse, and then there's a tiny post-ganglionic vagus nerve, which then triggers the organ. And I didn't know at that time if my vagus nerve was damaged. I don't think other patients always know. It's very easy to damage. Is that possible? Sure, it's possible. I didn't know what was happening. But I thought, as far as I know, I still have that tiny post-ganglionic nerve. And I remember the professor at school saying, and why I remember this, I have no idea. He said, the post-ganglionic vagus nerve is so small, it's almost a part of the organ itself. I said, maybe I can stimulate that. Okay. So the neurotransmitter acetylcholine is not a drug. You can't take it. The body breaks it down immediately. But instead, we learned what the agonists or imitators of that is. And I thought, for the vagus nerve, that special nerve, it's a nicotinic acetylcholinergic nerve, meaning its agonist is nicotine. So I used a nicotine patch and put it on my abdomen, and the valve opened right up, had a normal bowel movement, continued to use it until the inflammation that nicotine was activating almost ate me alive. But we used that to test the functioning of that postganglionic vagus nerve. The patients did fine. So it told us this was not an autoimmune condition shutting down these receptors. The receptors responded to that agonist beautifully. But instead, I looked at, okay, if the receptors still work, could we develop something orally that would trigger those receptors, not only of the vagus nerve, but could cross the blood-brain barrier, support cognition, and we could prove it was hitting both the nicotinic and the muscarinic receptors by looking at pupil size. And indeed we could. So that's where those patents came in, and the product is called Parasym Plus. That'll put the vagus nerve functioning back. So anyone who is struggling with some sort of chronic inflammatory condition, you need to keep that nerve working. And it is challenged in cases of chronic inflammation. And we look at our lives now, we go, what is chronic inflammation? It doesn't have to be POTS or EDS or RA or what have you. It can be aging. It can be menopause. It can be hormone surges. There are many forms of a low state of chronic inflammation that affects this nerve, and patients try to live with it because they're not disabled, like I was disabled. They might just feel tired or old, or they'll say, oh, I've just been under stress, or I'm not eating right, or whatever. If we could support that neurology, they feel so much better. One objective clue we have is the eyes. And that's where, fortunately, my background as an eye doctor really helped. We can see in these chronically affected patients, their pupil size tends to be just a little bit bigger. And it will normalize within a day or two of Pearson Plus. Yeah.
Dr. Kiltz, you were showing something, but we don't see the screen very well. I couldn't read what it was.
Pistachio.
You have changed your diet, huh?
Did you bring enough to share with everyone in the class?
This is what they hand out to us. They give this to us. But I just wanted to show they need to have steaks. They need to hand out steak for everyone. Right?
Well, that's probably better than the pretzels, right?
I don't know. I don't know. We don't know that. That's what they say. Probably not true.
Pistachios give me severe pain, muscle widespread, like a fibromyalgia, severe pain. Just having some pistachios.
Yeah. You know, it's interesting too for our POTS patients, because this is still viewed almost like low blood volume, which isn't the cause of POTS, but that's how doctors tend to see it. The first thing they recommend to patients is high levels of salt and trying to get blood volume. And as we know, high levels of salt is so damaging for the vascular endothelium. So the traditional approach to POTS is either keeping patients sick or worse, making them much worse. Yeah. And I think as we continue to push, we've got to reevaluate this. Someday, hopefully soon, researchers will look back on this and say, we really messed up with these patients. We really did them a disservice. Yeah.
We have a comment from Dr. Kiltz here. All autoimmune conditions are simple inflammation from plants and the microbes in the gut.
Yes. And I would add to that the interplay of how estrogen affects vascular endothelium and inflammation is an interesting one, because probably 90% of our patients are female. And I thought, okay, we're not a weaker species, what is the difference here? But estrogen can be vascular protective, which is great. But it can also worsen vascular inflammation when it's surging, much like a surge of blood sugar or insulin, what have you. When we see inflammatory patients, we like to think, and I don't know that it's the case, Dr. Kiltz, but we like to think, let's be as proactive as we can in controlling this inflammation, allowing your body to recover, and perhaps it could help you avoid the development of autoimmunity. We don't know that because we do know there's some genetic setups for that autoimmunity. But I think in females, we have an extra issue because of the effect of estrogen on our bodies. And we have that wild swing, once a month that kind of sets us up. And there's, as far as I can tell, correct me if I'm wrong, we can't stop that swing with changing our diet. We still have that estrogen swing. And that's difficult.
That's normal. But inflammation is not an autoimmune condition. It's an inflammatory condition from the foreign antigens and microbes. And so we make it complicated, but it's simple. the testicles and the ovaries are very important organ systems that are damaged by the diet. And you can turn it around by going keto, or better yet, carnivore. And that's the kind of the challenge for people to understand that simplicity. Women's hormones fluctuate. That's normal. That's the normal process. But the inflammation secondary to plant antigens, chemicals, and sugars, and then the fermentation in the gut, which damages the very gut, which damages the vagus nerve, which damages the post-translational modification of all molecules. And that's the real simplicity of the story. You're right. It's in the gut, and the vagus nerve is damaged because the myelin sheath is damaged, but also the neurotransmitters are damaged because the microbes make alcohol, autoimmune syndrome. Alcohol, everyone that eats a plant, low animal fat diet, and they keep feeding the gut all the time. That's the deadly story. And you'll fix your hormones, male and female, by the way, and you'll fix them because you quiet the inflammation, you suppress it, and your body is not autoimmune; it's foreign immunologic particles. And I don't know, can you guys? About hard to hear because I'm on the airplane.
We can hear.
Okay. Got it. But again, it's fascinating. You're right. But we're all trying to put together a simple story, because when we find the simplicity of keto and carnivore and fasting, it heals everything. And faith first, the power of the mindset and the power of God within all of us, and the power of eating our ancient biblical diets, which were animal based, and less eating and more social connections instead of eating alone at home or at the bar. Not good.
Yes. Would you say then, for most women who are struggling with feeling sick when around the time of their cycle, is a carnivore diet preferred over a ketogenic? Yes.
100%. Yeah. It's one of the game changers. Again, it's radical, but it's fatty meat. See, most carnivores eat lean meat.
Yes.
You're breaking up, Dr. Kiltz, getting freezing up as well. Let's take one or two more questions because we are getting close to that time. And while you select a question, I want to remind people to go to, let's see, potscare.com. And I'm reading the website, and depending on how you look at the words there, POT and scare, potscare.com, but it's potscare.com.
What are you?
All right. Do you have a question, Alia?
Central serous retinopathy. Of course, I'm an eye doctor, so we've seen that. We have never seen a case at Potts Care, so I don't know that, I'm specialized in that. But after 8 years, mine was healed on carnivore. That's excellent. We do know that tends to get worse with stress. Okay. So it would make sense that if you can take insulin surges down, I don't know if you were overweight at all, that it would help some healing process. That makes sense. That's amazing that you had that for 8 years and then it went away. That's amazing. Yeah. So you do want to watch stress level, certainly, but it hints that there was some sort of inflammatory process going on, right? Yeah, that doesn't happen for no reason. And this is a condition where there's fluid buildup in the back of the eye, underneath the macula, which can dramatically affect vision. So it's frustrating to treat. Yeah, oh, that's great. That's
Okay,
great.
next question,
Mhm.
Alia. Alia, are you muted?
I am muted. Sorry. I just want to let you know that I suffered from endometriosis for a very long time, like incapacitating, 21 days on a carnivore diet. I tried everything, including narcotics, to not be in pain. Like, I don't, not
Yeah.
like not over the counter drugs, like prescription drugs to not be in pain. And 21 days done. So I just wanted
That's
to point
wonderful.
say that. Yeah.
Is this something that, and we see some endometriosis at PodScare, we see a fair number of, inflammatory patients. So that is one condition which can contribute to systemic inflammation.
Mm-hmm.
So we do see that. But is that something doctors now at this point, like if you go to a doctor for endometriosis, is this anything that's in the literature, or is this just a one-off, N equals 1, I got better with it? Or are there trends? Do we know?
You got it.
Dr.
The
Kiltz?
trends are in the YouTube channels.
Dr. Kiltz?
Yeah, Dr.
Yeah,
Kiltz.
yeah.
Are you able
It is in the literature, but it's small and hidden. But basically,
Mhm.
endometriosis is a gut disorder. Gut inflammation spills over directly through the rectum, anus, vagina, cervix, uterus, tubes, and ovaries. It's an infection. It's an acute and chronic infection of the microbes that grow in the gut and infect a woman's pelvis. And they think it's caused by their menstrual periods. It's not. It's caused by the gut microbes and fermentation. But the best culture media is blood. And women did not have menstrual periods as much as they do today because they were either pregnant or breastfeeding. Now every woman wants to prevent their getting pregnant, and we're hopefully exactly what you're talking about is teaching more how the POTS is just another gut inflammatory condition due to a deadly diet. That's all it is. And so is infertility, so is endometriosis, so is macular degeneration. It all begins in a deadly, deadly diet that human beings are not meant to eat. Radical.
Okay.
all right?
Oh, we got to
Give
do the giveaway.
giveaway.
Yep.
And again, potscare.com. That's where you would find information from Dr.
Let me speak one
Driscoll.
other thing.
Go ahead, Dr. Gill.
Genetics are not the cause. We're not a bird, we're not a fish, we're a land animal. We're meant to eat a fatty meat, and we're eating a non-genetically defined diet for a human animal. That's why. But it's not our genes. It's our glycocalyx that and our post-translational modification that is damaged due to the plant microbes and also the neurodegenerative substances that come from this diet.
I have a very special interest in endometriosis. I don't have it personally, but in the research we did, we were looking at these vascular changes, these very subtle ones. And I suspected the endometriosis was more of a systemic problem. Could it actually be causing a similar cardiovascular response? And we included endometriosis in some of our studies. And we could see on the vasculature the same fibrosis. So I stepped back and look at how is that specific inflammatory condition affecting then the cardiovascular system? How is it worsening people? But our work is in genetics, and I know we have to be very careful not to blame the patient for illness. If they get sick, like my 8-year-old son, it wasn't his fault. He was eating the same things everybody else was eating. Why did he get sick and not other people?
Well,
there are some genetic setups that cause us to be susceptible to it.
Well, it's like smoking cigarettes. 10% of smokers get lung cancer,
Yeah.
but they all get something. Don't end it, Alia. Leave it going. This is very important.
Okay. I'm not ending it.
All of it begins in the gut because the glycocalyx is trying to protect you, but we're breaking it down because of a family diet, which then spills over into the vascular system, which causes every disease we know, 17,000 of them. And so a car like a Ferrari, the brakes break, the ignition breaks, the tires break, the engine breaks, everything breaks, but not all at once. And so why one over another? That's the mystery that is environmentally, but it's not, it's we're always looking for genetics. It's not it. It's everyone's going to die and everyone's going to get something. We know that. The problem is we bring science in trying to explain why you got it and the other person didn't. We're not that good. It's because you haven't waited long enough. Because one person gets migraines and other people get indigestion and other people get arthritis. And it's just part of the same cause. The vascular system, you're right. The glycocalyx of the vessels is damaged due to plant sugars and the inflammation caused by all the other chemicals and microbes and things like that. That's the magic, what you're doing. So keep doing it. But endometriosis is just inflammation of the pelvis. That's all it is. We're making it like some complicated thing. It's not. So simple.
Well, someone like with EDS, I'll air quote that, who clearly the structure of the collagen is affected. And if those genes also overlap with regulation of certain types of inflammation, it doesn't have to all be triggered in the gut. It can take almost anything to get them going. They can't control that type of inflammation.
It starts in the gut. So the gut is number one because it lets in the lectins, oxalates, phytates, the microbes, the alcohol, the aldehydes, the methane. And so, again, we're all in our special little boxes. Fertility, POTS, endo, eyes, all these diseases. But because we all focus on a specialty, we all think these diseases are different. They're not. And an alcoholic can either get brain disorders or liver disorders or vascular disorders. It's all caused by the same simplicity. And that's the beauty when we all come together and recognize you cannot change someone's genes, but you can change the environment. That's the beauty of what we're doing, environmental changes. Radical. You're doing it, we're doing it. And when we create a simplicity, because the masses require a simplicity, and the cost of healthcare is too expensive. And what we're doing here is we're empowering everyone. And look, I'm at 40,000 feet on my way to Sarasota, and we're able to communicate. Doug's right next to me. He's an IT system security guy, goes around the world, makes the connection so we can do all this shit. And the beauty is the power of social media to give people the N of one stories, right? And then we realize that there's N of infinite stories. And the stories are so powerful. So I'm really grateful to you, Diana, for being here and sharing, because it's good to look at our genetic predispositions. There's one massive human diet, and that's carnivore. Carnivore.
Yes.
Go ahead.
There is one thought I would love to keep minds open toward, and that is, could the inflammation in some patients, and I'm thinking specifically EDS, joint hypermobility, Could the inflammation begin in the connective tissue and go outward from there? I mean, there is connective tissue in the gut, but there's connective tissue throughout the body. And many of these patients end up with like the fibromyalgia or systemic wide pain. And it's not necessarily sourced in the gut, it's sourced in connective tissue or collagen. So it's kind of a bigger problem, if that makes sense. Whereas I think what you're saying, Dr. Kiltz, starts in the gut and goes systemic. Could some patients start systemic and end up in the gut?
No, not likely, because if you fast, you eat nothing for a month, all the diseases go away. Because think of the smelly, poopy, infective stuff in the gut, which breaks down the glycosaminoglycans, which are connective tissue made by sugar, and we're putting too many foreign sugars. It's still more likely it begins in what's outside that gets inside and causes the damage. And the number one place that most of the shit gets into our body is the gastrointestinal tract. And again, it's because everybody who has EDS or has POTS, I will bet you $1 billion that they're all consuming a standard diet or even a keto diet, and they're not adding enough animal fat and eating less frequently. Again, the all or none is impossible because the gray zone of all of this is so big because we're not watching what everyone eats. And so it always starts from outside of us. And the gut is the best way for anything out there to get into our blood vessels. That's all I'm saying. And you're right. But again, I will say that the problem is changing politics, religion, diet is like impossible, right? Impossible.
Right.
And scientists and doctors are very, very close-minded.
Yes.
We believe what we believe, and we're not very open to change. That's the craziness.
I think
we're very
it was probably accepted much earlier, right? Intractable epilepsy responded well to high-fat diets. Yeah.
Well, but the term high-fat diet, like is avocado fat or is it a plant?
I don't know what they do for epilepsy.
Oh, an avocado is considered fat by many nutritionists, right? But it's a fruit. It's highly allergenic. And I think the standard nutritional science is snake oil. But I am grateful I was even able to connect and get a chance to listen to your masterful work, and I appreciate you.
I appreciate you, Dr. Kiltz. Things clearly need to change for so many people, and they don't get validation for the suffering they go through. So, yeah,
I agree.
To so many,
And looking at genetic predisposition, I think is good. Is important because I think that there are definitely links there. And I think, if we could help so many POTS and endometriosis and depression, and I did, both my brothers have lost vision and my sister lost vision. She had type 1 diabetes, and my mother went blind. Eye disorders are so common. So we're inspired by the pain and suffering. And that's why I'm glad that everyone's here. So
me too.
Any last minute? Thank you.
Yeah. I'm so grateful to you.
Thank you very much. And Dr. Driscoll, any last words you want to say before we sign off?
I think just for anyone suffering out there with whatever they're dealing with, and it's considered invisible or the doctors can't put it together, it doesn't mean there isn't a way out of it. And they may not have all of their answers today. They may still be working through it, but basically never give up hope. in being able to recover from whatever they're dealing with. Never give up hope. And there's new thoughts, every day. So yeah, hang in there.
Thank
Great.
you very much.
Thanks,
Have a
everybody.
great day, everyone.
Thank you.
5:30
you.
p.m. Zoom call in the community.
Okay. Goodbye.
Thanks,
Bye.
Diana. Bye, Diana.